So we have another fantastic case from Elsa this week. So this is the 2-year-old neutered female domestic short-haired cat with 6-week history of obtundation with recent deterioration. So we'll have a look at the MRI now. This is the MRI, so we'll start off with the transverse T2 weighted image. So the T2 is often the kind of most useful series, so we'll just scroll through. So we can see as we go from rostral to caudal, we have a congenital anomaly of the frontal sinus, so wouldn't be overly concerned by that. Looking at the brain, we want to be comparing, are left and right side symmetrical? Do we have any signs of mass effect, midline shift? Is there any signal alterations? What's the architecture of the brain like? So here we can see we have a degree of dilation of the ventricular system, the lateral and third ventricle slightly distended and rounded in shape. Extent coming caudally. We can see the parenchyma looks relatively normal in the forebrain. And then as we come into the cerebellum, caudal fossa area, we have this lesion here in the left cerebellar hemisphere. So we have a kind of rather ill-defined focal lesion, predominantly iso-intense to normal grey matter, but quite heterogeneous in appearance. Quite a marked mass effect associated with the lesion. We can see displacement of the adjacent structures with compression. Adjacent to the mass, we have quite extensive, kind of ill-defined T2 hyperintensity. So comparing how the lesion looks on the different sequences, we can see that on the T2 star green tecal sequence here down in the bottom left, the lesion looks hyper-intense. We don't see any signs of signal void to suggest hemorrhage. On the T1, the lesion is intermediate in signal, so iso-intense to normal parenchyma, but with some areas of lowish signal, which are also lowish signal on the flare sequence, so potentially some small cystic areas. The flare sequence here shows very nicely the lesion and the more extensive perilesional T2 hyperintensity, which would be consistent with perilesional edema or inflammation. So here we have the pre-contrast and post-contrast images, and in this case the post-contrast images are extremely useful. So we can see avid, dense, slightly heterogeneous enhancement of the lesion, which appears mass-like, so relatively circumscribed, relatively homogeneous enhancement in this area. But extending adjacent to the mass, we have extensive meningeal enhancement, so we could call this a dural tail sign, so extending periphery from the mass, and additionally we have quite extensive increased enhancement of the meninges, so we can here see along the side of the cerebellum, and then more rostrally we have this abnormal enhancement along the margins of the mesencephalon. So we have a focal solitary mass lesion with some meningeal enhancement, quite an irregular shaped mass. So from a differential point of view or an interpretation point of view, the key questions we want to be answering is, do we think this is intraaxial, so rising from the neuroparenchyma, or extraaxial, so rising from the meninges and some more or adjacent structures? So I'll let you have a look at this for a second. Have a think, what do you think, intra or extraaxial? Lesion shows primarily characteristics of an extraaxial location. So we can see here it's broad-based, peripheral in location. It's got a dural tail sign, dense, relatively homogeneous enhancement. So these would be all features which are more commonly seen with an extraaxial location. There does appear, however, to be some invasion of the parenchyma. So here we can see on the T2 weighted images, we don't see any inward displacement of the grey matter, which would often be seen with an extraaxial lesion. So whilst it's predominantly extraaxial, there does appear to be some invasion of the neuroparenchyma. So it's important when we have mass lesions to assess for the secondary effects. So the sagittal T2 weighted image is very helpful for this. In this case, we can see it shows this foramen magnum herniation. So we have the caudoventral herniation of the cerebellar vermis here through the foramen magnum, which is compressing the brainstem, which is displaced ventrally here with attenuation of CSF in the basal cistern. The dilation of the ventricular system that we saw would be consistent with early obstructive hydrocephalus. So in summary, the MRI shows the presence of an extraaxial mass lesion adjacent to the left side of the cerebellum with invasion. There's localized meningeal thickening with abnormal contrast enhancement, and the lesion is causing mild obstructive hydrocephalus and foramen magnum herniation. So in terms of differentials, the primary differentials in this case in a young cat would be infectious or inflammatory disease. So we'd be thinking about granulomatous diseases such as protozoal diseases. It'd be somewhat atypical for FIP. We'd also need to consider lymphoma. And although very rare, this would be a predilection site for medulloblastoma. Meningioma is a common cause of extraaxial mass lesions in cats. However, the location, the age, and the meningeal changes would be slightly unusual, so I would probably rank this a bit less. So hopefully you find that interesting, and we'll look forward to finding out the outcome of the case later in the week. So thank you.